everyone, and we're back today with Badrul Hussain. He's a consultant ophthalmologist at Moorfields Eye Hospital Private. Badrul, thank you so much for joining me here today. Tell me about yourself. What do you do at Moorfields?
So I'm Badrul Hussain. I'm a consultant at Moorfields Eye Hospital. As well as that, I help to run the cataract service as deputy director of the cataract service. I also run the training, so we have about 40 or 50 trainees that come through every year. So I'm also the training director, coordinating the training for our trainees who come through cataract surgery. I also help run the sort of rapid access at Moorfields Private. And I know you're going to ask me questions about Moorfields Private.
I will. That's a lot of different hats.
Lots of different hats. My head is getting heavier.
How do you manage your time between everything at work?
Yeah, it's a lot of negotiating with the better half at home, because it's getting that balance right between home and work. And
it's important.
Work is busy, but you've also got to make time.
Moorfields Private, it's relatively new, or it's been there for a long time? Because a lot of people haven't heard about it.
No, Moorfields Private's been there for many, many years. It's been there at least 30 or 40 years, even before my time there. And the Moorfields Private side is the private entity of Moorfields Eye Hospital. So Moorfields Eye Hospital, has been there for 200 plus years. The Moorfields Private side is the consultants who work on our NHS side, also offer that expertise to private patients. And the profits from our private side, unlike other organisations that are private, they go back into the NHS to help run the servicing of our NHS.
So when I came to your launch for Moorfields Private on Cavendish Street, I heard that. And I was amazed, because I've never heard of a private organisation feeding back into the NHS organisation.
No, there are models for that. So, I don't think we're the only ones in the NHS who provide private services that then come back into the NHS. So other hospitals do, like the Royal Maudsley, Guy's and St Thomas's, they're private wings. And I think people sometimes think, private healthcare is for profit. Not always. There are NHS organisations that do run private services that help their NHS services
like
continue.
A lot of cataract surgeries, clinics, for example.
So there are private providers of cataract service who a lot of cataract surgery is now being done in the private sector. They are wholly private entities. Their profits go into private entities. They don't come back to the NHS.
What's the best part about working at Moorfields Private?
The best part of Moorfields Private is it's part of the Moorfields family. So the organisation that I work for most of the time, the Moorfields NHS side, I work with alongside the same colleagues there. I work alongside the same nursing team that I work in theatre when I'm doing cataract surgery. It's a continuity. It's not like going to a different place. All I'm doing is offering my services to patients who might want the convenience of being seen a little bit sooner, might want the convenience of seeing their surgeon directly, because obviously on the NHS we can't always guarantee who patient's surgeon will be. We work as teams. Privately, some patients come because they want the assurance that the person they're seeing in clinic will be the person who's doing their surgery. So that's benefit, is that it's just the continuity of what I do day to day.
Often there's a misconception that the NHS service will differ from the private service and the actual treatment will differ as well. But that's not the case, is it?
There are differences, but what I usually say to patients who come to see me privately is, what am I getting different? Well, I say there are two main things. Convenience. You choose the time on the whole when you come and see me. As long as I'm available, I can see you probably quicker. Because on the NHS, especially these days, post-pandemic, there is a bit of a backlog, and we're trying to do our best to catch up with the backlog. But despite that, there can be a bit of a wait, and patients who want to be seen very quickly, that is part of the convenience.
I was going to touch on that. Post-COVID, have you seen a spike in people going to private instead?
Not necessarily. I think if patients have private health insurance, that might be one option that sways them. If patients, let's say my area of expertise is cataract surgery. If a person is struggling with their vision, it's stopping them from driving, that might be a reason, because driving, they can't do their job, drive to work. Other patients may say, actually, my vision is a problem, but I can wait 2 or 3 months because it's not impacting too much, and I can wait to be seen on the NHS. So convenience, as I said, is the first thing. And the second thing is you're seeing the person who's going to be doing your surgery. I mentioned I'm training director. We have 40 trainees who
continuous cycle.
Training. So, we're a teaching hospital. Like most other teaching hospitals, most hospitals have a duty to train the next generation. And I think that's an important thing.
One of the most difficult challenges you face?
At the moment, part of it is the demand. So I also cover emergency eye care. So, everyone knows what's going on in emergency at the moment, how waiting times have gone up in most emergency departments. The good thing at Moorfields emergency departments, we only specialise in eyes. So although we're very busy, we don't generally have those challenges of 6, 7, 8 hour wait. We're able to manage that, but it's still a challenge seeing patients in a timely fashion.
Is the backlog improving?
The backlog of cataract surgery, I think, is improving. We're making headways, and during COVID, we had what was called a cataract drive, where we tried to get 1,000 cataracts done in a week by reconfiguring our services. It was a lot of work, and I helped sort out the rota of surgeons for that week and helped coordinate how we're going to get surgeons working in the most efficient way. Right. And I think we're thinking of other innovative ways of doing that. So I think one of the things we're thinking about at the moment is over a weekend, effectively trying to see hundreds of patients in clinic during the weekend when other clinics might not be running. It's not just always availability of the doctors. Remember, we need space to be able to see patients.
Yep.
And if we've got other clinics, let's say we've got a medical retina clinic going on and we've got a glaucoma clinic, we don't have the space to see the cataract clinic. Whereas at the weekends, we maybe have more space. So we have to think about how we utilise our time and our space as well as our staff in an efficient way.
There's a lot of challenges.
there's a lot of challenges, but lots of opportunities.
Definitely. It's great to see the work that you guys are doing. Tell me about the rapid access and urgent care clinic.
So again, this comes back to the emergency thing. Lots of patients these days, it's a culture change. You've got Uber, you've got delivery. Everybody wants everything instantly sometimes. Although we do our best to deliver in our emergency services, sometimes patients say, I just don't have time. Yes, it's important to me, but I can't be sitting around for 6 hours waiting to be seen. I can't be sitting around for 3 or 4 hours. So this is a way of where patients can be seen within 24 to 48 hours availability. So I help set up this clinic so patients who want to be seen quickly are provided with a diagnosis and a management plan or what to expect. It's a way of offering that to them on a private setting, which can be quicker. Yes, it does cost money, but convenience for everything, just like your Uber and your deliveries carries a premium. Unfortunately, there's a little bit of a premium.
But I guess those who can afford it or have the insurance for it, they see the benefit.
Unfortunately, rapid access, we can't see insured patients, so that's the only thing.
Okay,
so it is patients who can self-fund themselves. But again, like you say, it is a premium.
Is it quite popular?
It is quite popular. We're quite busy throughout the week, so it runs 2 till 6 every day of the week.
Amazing. Well, Badrul, thank you so much for taking your time to come and speak to me.
Not at all. My pleasure. Thank you.